Are you able to see the screen also, no? We did CPT basic guidelines and modifiers. Today onwards, we can discuss the some concepts related to the CCS exam. Guys, you will get 3 to 4 case scenarios related to the CPT. For this, we need to learn some guidelines and some procedure code leading and elimination the method options like that. Okay. First concept, note down debridement. In debridement, you will get some multiple choice questions. Okay. This debridement concept will get in the integumentary system below the 10180 code. So here they given see wound debridement 110422 to 11047. This is the code range of debridements. Okay, code range of debridements 110422 to 11047. Clear? First, what is the meaning of debridement?
Removal of dead tissues.
Removal of
Dead tissues.
dead tissue from wounds, correct? Dead or damaged tissue from the wound. Consider as debridement. So while we are coding the debridement, first thing check types of debridement. We have 2 types of debridement. Non-excisional and excisional debridement. Guys, based on the performance, how they are performing, based on that, we have these 2 types of debridements. So non-excisional debridement means removal of dead or damaged tissue by using chemical cauterization, electrocauterization, extraction, scraping, rubbing. Okay. Excisional debridement means by using instrument. Okay. So how they are performing the debridement? Just check either by instrument like knife, blade, scalp, sharp object. Okay, sharp object. So here, guys, remember whenever they performed non-excisional debridement, we have only one code from the medicine 97062. This is the default non-excisional debridement code. Whenever they are performing the excisional debridement, we need to check how they performed. Okay, how they performed excisional debridement, we need to check. Here we have the code range 110422 to 11047. So guys, first thing, whenever we are coding the debridement, check the type of debridement. Excisional or non-excisional. After that, identify depth of debridement. Okay, at what depth they perform? Subcutaneous level, muscle level, bone level. Okay, what level they are performing the debridement we need to check. Based on the depth we have code. What depth they performed, based on that we have the CPT code, guys. So compulsory check the depth of debridement. Without depth, if they not mention the depth in the debridement, so definitely we need to pend the document. If they not document the depth of debridement, definitely pend the document. Clear?
If they not mention debridement, then what?
If they not mention the debridement type also, we need to pend the document. Okay, type depth compulsory they need to document. Okay, if they not mentioned depth and type, it should be difficult to code the debridement. You can pend the clarification, pend for clarification. Now, they documented depth of the debridement and type of the debridement. If non-existential, no need to check anything, directly will get code 97062. Whenever they perform the excisional debridement based on the depth, we have the codes. And single wound, multiple wound guidelines. Okay, whenever they perform the single wound debridement, okay, patient have only one wound, they perform the debridement. Check the depth. If they documented multiple depth, code deepest
Or
depth.
I used to.
Okay, code only deepest depth. Suppose they mentioned patient perform the debridement on left leg, muscle level, bone level, subcutaneous level. What depth we need to code?
Which is having deepest depth. That should.
Depth bone
Bone should be the deepest. Superficial should be skin, then subcutaneous tissue, then fascia, muscle, tendon, bone. So bone should be deepest. When they documented multiple wounds, this is important, guys. Whenever they documented multiple wounds, check the depth. Both wounds same depth. Both wound same depth. Sum the surface area of those wounds. Okay. Both wounds same depth means sum the length. Okay. Suppose wound A 20 centimeter, wound B 20 centimeter, they performed on the muscle level. We need to code for the 40 centimeter. If depth different,
Yeah, same side, right?
not same side, different sides. Both wounds. Okay, here multiple wounds. Single wound, different depth, code deepest. We are coding now multiple wounds, different depth. Wound A muscle, wound B subcutaneous. Wound A
Okay.
muscle, wound B subcutaneous. Now code both. Deepest should be sequence first. Deepest should be first. Okay. So total we have three wounds wound level codes, guys. 11042, 475, 47. Okay, so first see 11042 should be debridement of subcutaneous tissue, first 20 square centimeter. This is the additional code for subcutaneous. Suppose if they done subcutaneous tissue 25 centimeter, how we need to code na? For first 20 square centimeter, we need to code 11042, then 11045 for remaining 5 square centimeter. Clear? 4245. 43. Debridement, muscle and face includes dermis and dermis subcutaneous, so up to muscle level, first 20 square centimeter. This is the add-on code for muscle. 20 above, each additional 20, which means 40 up to 40. More than 40 means we need to go with one more time add-on. Then 11044 should be bone. This is the bone add-on code. Suppose now tell me 30 centimeter bone level they performed. What is the code will code?
110.
11047.
11047.
1047.
11047. Clear? Now we have some practice questions related to debridement. You can do, guys. So remember, in exam point of view, debridement related, you will get questions like different depth of the debridement they performed, single wound, how we will code. Okay. Then
So first, how to lead the debridement code?
now only I show, right? 1104 series. Do not lead index directly. They are giving optional. Now that's why I'm practicing the examples here.
Okay, if we don't to lead under index directly, yeah?
You can go with the debridement if you want. Under debridement,
Oh,
you will. But I
okay.
am saying this is the easy way.
Okay.
Anyway, if you lead in index also, again you need to come for the code description to confirm. That's why. So identify 24th question.
పనిలో బాగా వర్షం కూడా పడక అది కొంచెం లాస్ట్ వచ్చింది.
Identify the answer for 24th question. Guys, don't do time pass. At last, don't text me. If I read the paper only, can I pass? I don't read anything. Can you join in next batch like that? Practice చేయండి. What is the answer?
1 minute sir, checking.
Okay, guys.
Option B.
Yes, option B.
Option B. So here, how many debridements patient have? Total, how many wounds they perform?
2 sir.
Two.
3 wounds, right?
1
25
inch per
square
bone
centimeter of ulcer of right calf, 10
per
square
bone.
centimeter of right heel, and 15 square centimeter of left heel. Now check these three wounds depth. 25 should be
Per
bone,
bone.
10
For
and
bone.
15 should
Yeah.
be subcutaneous, right?
Yes.
Same depth, so we need to sum these two lengths. 25
Mm.
and bone 25. So what is the bone course? 11044 for first 20, then each additional 20.
20.
First 20
Yes.
subcutaneous, each additional 20 subcutaneous. Here we need to append 59 for the
Mm.
lower depth.
If the code is particular, we got right, then we should not check for modifier, right?
Not required if they're not given modifiers.
Not like why you have only not have 15 applicable is same, right?
Not same, not different depth, right?
So okay, even if the depth is different, and they have done in the same
If
encounter.
depth is different means procedure also different, no? Not same procedure, right? Same depth, just same procedure, they procedure on the different location. Here they are doing in the different depth, not same depth. So it was
Yes, sir.
different. 34 question. Just note down wounds and their locations, then it will be easy.
D.
D here. See here.
Can be
B here. So total how many wounds we have?
3 wounds, sir.
12
3
square
wounds.
centimeter, 8 centimeter, 16 centimeter. So what is the depth for this 12 centimeter?
Fascia
Fascia. So fascia, what is the code?
11043.
0043.
11043.
D option.
So option B eliminated because there is no 11043 here. Correct? Yes or no?
Yes.
Sir.
Yes.
Now remaining how many wounds? A wound of the left shoulder measure 8 centimeter and 16 centimeter. Both performed on what depth?
Subcutaneous.
Subcutaneous.
Tissue.
Subcutaneous. So we need to sum the length, right?
Yes.
D
For
option, sir.
24 square centimeter. 11042 for first 20, each additional 24.5.
Yeah, option.
A option. Why we need to code 2 times primary code? We need to go with only primary code 1 time and you need to give for the remaining depth additional code, not the same code.
Okay, sir.
Okay? So sum the length means we need to code both and remaining depth we need to use the add-on code. That's it. Clear? Debridements.
Yes, sir.
Lead this code. Last question.
Sir,
Tell me.
the previous question, all same depth, no?
No, right? Fascia was different depth. No, fascia
No,
comes under muscle.
okay. 33 questions, sir.
That only I'm saying. Fascia, right? In that they mentioned one was fascia, remaining two was subcutaneous.
Okay.
Sir, question is not saying
What not say?
little bit smaller.
What not saying here? Tell me what's your doubt in this question.
The previous question, sir.
This is the previous question, bro.
Okay.
What's
There
your
is
doubt?
not.
Fatafat ask, guys. Okay. So here what they are saying, 12 centimeter involve the fascia. Clearly they mentioned fascia, right? Fascia comes under muscle. Under 11043 we have check. So if you are delayed, don't expect within 20 days, 15 days. Okay, wow. It will extend. Muscle, fascia. 11043. Lead this question, 12th question. Just note down the wound locations and depths. Then it will be easy. If same depth more than 20 square centimeter, use add-on code. If that both wounds same depth, sum the length. That you need to apply.
D. Option D. Sir.
Option D.
Option D.
D. Correct.
Hmm.
Everybody agree? You have any question? Ask me. If I move to next question, then don't ask the previous question like that. If you have any doubt, now it's well clarify.
Can you explain?
What's your doubt? Tell me. Tell me what is your doubt. I will explain. Please reply, bro. Who are asking? Please give reply. Then only I will shout out your doubts. What you didn't understood, tell me. I will explain.
For right cuff, they are telling subcutaneous tissue.
చూడండి, మీరు అడిగి సైలెంట్ ఉండకండి. క్వశ్చన్ అడిగాక మీరు దానికి ఆన్సర్ చేస్తేనే మీకు రిప్లై ఇవ్వగలను. ఓకేనా? మీరు అడిగి సైలెంట్ ఉంటే నేనేం చేయాలి చెప్పండి. చెప్పండి సంథింగ్ యువర్ సేయింగ్.
అన్న రైట్ కాఫ్ కి సబ్క్యూటేనియస్ టిష్యూ ఇచ్చారు కదా, కానీ డి ఆప్షన్ లో 11044 అంటే బోన్ లెవెల్ కదండి.
చెక్ టోటల్ హౌ మెనీ హోన్స్ ఉన్నాయి హియర్. The doctor debrides 25 square centimeter ulcer on the right calf subcutaneous and 10 square centimeter ulcer on the right heel debrided subcutaneously 35. Then also 15 square centimeter of left heel debrided as the bone, right? Here they done the 15 square centimeter left heel also, no bone level.
Sequence we should code as lowest depth, right, sir?
Yeah, deepest should be always sequence first.
Yeah, in fourth option, first deepest code is there. So
Then
got a little bit confused.
yeah, anywhere when they given multiple debridement, we need to go with deepest first.
Yeah, here in this question, deepest code is first, sir. 11044.
Always deepest only first, bro. In this question, not only the question. While we are
Yes.
coding regular also, deepest we need to give the sequence first.
Yeah,
Then
okay.
remaining. So don't code what they performed here first. Not like that. In this, what is the deepest? That we need to give the sequence first.
Yeah,
Don't code
okay.
cough, ulcer like that. What is the deepest? That we need to code sequence first. Clear?
Yeah, cleared.
Thank you, guys. So here you will get to multiple choice questions like single wound, multiple depth. They documented how we will code, and patient perform the debridement on right thigh wound. This operative report sufficient for the coding. No, we need type and depth of the debridement. Without type and depth, we depend for the clarification or query. Next concept note. Skin tag lesions removal. I actually asked to read these points, but nobody read it. Removal of skin tags. So here also we'll get one multiple choice question, guys, in this concept. Only we have two codes for the removal of skin tags 11200, 11201. How to lead in index? Skin tag lesion removal. Directly will get. Okay, skin tag you go will get. So here removal by scissoring or any sharp method, ligature, strangulation, electrosurgical destruction or combination of treatment. So whatever the method they use to removal of the skin tags, how many lesions they performed, that should be important. Okay, including 15 lesions, up to 15 lesions. If they performed 11200, if they done each additional 10 after the 15, each additional 10 are part of thereof means 1 to 10. Okay, after 15, 1 to 10. Suppose if they done two lesions removal, what is the code?
11200.
200.
11200. 10 lesions.
00.
11200.
15 lesions.
11200.
200.
20 lesions.
11201.
200 Two codes.
11200, comma 11201. Only
11201.
11201 we should not code. Okay, wow. Only 11201 add on code we should not code. Below they given use conjunction with 11200. Plus symbol codes don't code directly. Suppose now 30 lesions.
11200.
11200 11201 into 1.
2, not 1.
Into 2.
Sorry, into 2.
Into 1 means only one time into 2. Fourth question.
Option A.
1200. Option A.
11200.
Option C.
C.
Option B.
Option
Option C.
Option C. Okay, option B we should not code. I am telling directly. 11201 we should not code directly.
Should
Primary
code with
code,
primary
add
code.
on code. Okay, wow.
Yeah, okay.
11200, 11201 option C.
Option C. Into 2.
Into 2. So guys, here one thing remember. While we are coding, one same codes they will give for 24 lesions. Patient performed. They will give option A 11200, 11201. Option B 11200, 11201 59 modifier. Which one is correct?
Option
First one. First one.
name only, sir.
Modifier,
Because
right?
Add-on
Mm,
code not more internal
no
one.
need to use.
Add-on code was not a separate procedure, so no need to code any modifier. Okay.
mm.
We should not append modifier for add-on code, right?
Yes, yes. Along with
For-
primary, while we are adding add-on code, not required modifier. Okay. Add-on code was included in the primary.
Yeah, we can append modifier for primary code
If required.
based on the question.
Correct. So that's it for skin tag lesions. Everybody understood, right?
Yeah,
Yes,
okay.
Next concept note down. Ingrown nails related procedures. Nails related procedures. Here also one case study you will get, guys. Okay. So if they're done trimming of nail, any number, you will get 11719. Under nails, you will get these all procedures. Then debridement of nails. Debridement of nails, when they performed, we need to check how many nails they performed. Okay, how many nails they performed. Next, 11730. Okay, avulsion means excision of nail. Okay, excision of nail plate, partial or complete, simple, single. Each additional nail plate add-on code. Based on the primary, how many nail plates they done avulsion. Then evacuation of sublingual hematoma, 11740. Excision of nail and nail matrix, partial or complete. Example like ingrown or deformed nail. For permanent removal, if they done permanently nail, 11750. If they done only avulsion, 11730. If they done each additional 32. Evacuation of sublingual hematoma, 40. They done debridement, 20 and 21. If they're trimming the nails, direct to code how many numbers they done, 11719. Here we have one case study related to this. Ingrown toenail related. We have case study related ingrown toenail. Any doubt?
Any questions from this topic, nails?
Give the questions, don't worry.
Yeah.
Concept you understood, right?
Yeah, sir.
Seventh question.
Option A.
Option B.
A or B? Check.
1750.
50.
What they performed here?
Option A.
Nail
Without
plate
nail
removal.
matrix, right?
Yes, sir.
Nail plate removal.
Removes the portion of nail plates.
Option A.
Then B.
B, why we?
Option B.
Option A, evaluation of nail plates, sir. They did not mention any removal in the description.
What is the 11730?
That's
Evaluation of
evaluation of
nail
nail plate.
Evaluation of nail plate.
Avulsion also excision only, removal. Okay, avulsion or excision, same meaning. Clear? Huh? If they done only nail plate, 3-0. Nail and nail matrix both performed
750. 11750.
Okay. If they done only up to nail, 3-0. If they done nail and nail matrix both, what we need to take?
50.
750.
Uh,
11750.
Here they documented without destroying
Nail
Nail
matrix.
matrix.
Nail
Nail
matrix.
option A 11730.
30. Option A.
Option A.
Option A.
Option A.
T.
Option. Yes, sir.
Option D, sir.
Option D, sir. 1176.
Option D.
D. D.
Option
D.
A, right?
D.
Option
D.
A.
A
Option.
11730, na? Why you are telling D?
Sir, but ingrown nail.
Ingrown.
So avulsion also they will perform for ingrown nails. Okay. Avulsion also they will perform for any nail, guys. Ingrown nails also they will perform. What is the
Sir, but
11760?
the 11730 is excision of nail plate. Here they said total
Nail.
total so
Wedge excision of skin of
total
nail.
toe.
Ingrown. An example. Ingrown.
Toe nail. A patient performs avulsion of the entire left red toenail due to painful ingrown nail. So what answer you said?
Option
D.
D. 117.
Option D.
Option D.
11765.
Yes, sir.
Yes, sir.
11765. Wedge excision of nail fold. Example for ingrown nail. Wedge excision of skin of nail fold. Here they are removing nail fold. What is the meaning of fold?
One 11730 is right answer only, right? Here 11765 is skin of nail, right?
That's it.
Folding
One
skin, that one.
this
Matter
sequence
is ingrown nail. That's
No problem. Ingrown nail for they will perform for avulsion also they will perform for ingrown nails. Okay, wow.
and that excision also wage excision. It's not written anywhere
Because
wage
not nail
excision.
fold, guys. Okay, wow. Don't take 11765. Okay, wow.
Yeah, it's a 30 only.
Okay, avulsion of
30
nail
option.
plate should be 30 only. Wedge excision only 65. Okay. Option A 11730.
Yes.
Ninth one.
B.
Option
11750.
750 B.
Yes.
11750. Nail and nail matrix they
B.
permanently destroy.
Removed.
Same question you will get in exam. Okay, wow. 11750.
Once the question display, sir. Once.
Hmm?
Yeah, okay. Yeah, okay, sir.
I will share these all questions with you. Don't worry. Okay, to practice. So here next concept, repair. Put heading repair. Repair or laceration repair. Heading. Repair or laceration heading. So what is the meaning of laceration or repair? No, wound closure. Okay, wound closure. Here mostly will get the diagnosis laceration, guys. So they will close the wound with sutures. So first thing remember while we are coding the laceration repair or wound closure, check the type of suture material. Some suture material should be codable. Some material should not be codable. What suture material they are using to perform the repair, that should be important. Here they given the list of the materials. Check this line para. They done utilizing suture, stabs, tissue adhesives, either single or combination with each other in combination with adhesive strips. Codable. Chemical cauterization, electrocauterization or wound closure utilizing adhesive strips such as the sole repair of material are included in the appropriate ENM code. Okay, this we should not able to code. What we should not able to code? Chemical cauterization, electrocauterization or wound closure utilizing adhesive strips such as the sole repair material are included in the appropriate ENM code. This we should not able to code. Clear? Huh?
Bro,
Yes, yes.
Means sir, repair code we don't with alien code.
I didn't get you.
Means repair code we don't code with alien code. Sir. This 9920190.
Actually, now what they are saying, while we are coding the emergency department or evaluation and management, in the ED or ENM, they perform the laceration repair. Okay?
Okay.
They perform the laceration. Check laceration suture material. If that suture material was codable, along with ENM, you can use the procedure code. This repair surgical procedure code. If the suture material was not codable, no need to code the surgical procedure laceration repair code. It was included in the ENM. Only ENM code enough when they are using the chemical cauterization or steri strips, okay, or electrocauterization. If the material it was included in the ENM, no need to code as laceration repair. They are saying, okay.
Okay.
Next, types of repair, guys. Total, we have three types of laceration repairs based on the depth of the wound repair. At what depth they are performing, we have total three types of repairs. So now onwards, listen carefully, guys. Simple repair, intermediate repair, complex repair. Total three types of repairs based on the depth. First, simple repair. Read what you understood. Tell me.
Single layer repair.
It requires only one layer closer.
What is the depth?
layer, simple layer.
Closure with derma bond or
Intermediate,
single
one or
suture.
more layers.
Dermis or epidermis?
Epidermis.
Epidermis.
They are saying epidermis or dermis or subcutaneous tissue without significant involvement of deeper structures. Okay, not only epidermis.
Dermis also.
Epidermis or dermis or subcutaneous tissue without significant involvement of deeper layers means superficial subcutaneous layers also. Subcutaneous tissue of superficial, not deeper. This is the depth and requires one layer. They will close with single layer. Whenever they perform the laceration, local or topical anesthesia was included in the laceration. Do not code separately. Clear? Single layer closure should be simple repair. Depth should be dermis, epidermis, or superficial layers of subcutaneous tissue. Next, intermediate repair. Intermediate means
one or more layer.
One or more.
Deep layer repair.
so here saying include the repair of wounds that in addition to above required layered closure of one or more of the deepest layers of subcutaneous tissue, superficial fascia. Here, deepest layer and superficial fascia should be depth. Then layered closure. If they mentioned layered closure in the procedure note, it should be considered as intermediate. Layered closure, multiple layer closure, two layer closure, multiple layer closure also intermediate. Layered or multiple layer should be intermediate. Then sometimes single layer closure also we can code as intermediate. Read these 3 lines.
If they close, then we should code intermediate.
That 3 lines, what they are saying.
Single layer closure of heavily contaminated wound.
Cleaning or removal of particulate matter.
What's that meaning? Tell me what they are saying. Whenever they performed a single layer also, whenever they performed single layer also, check that single layer closure. If they done any extensive cleaning or heavily contaminated wound or removal
Foreign
of
body.
particulate matter means foreign body. Particulate matter means foreign body. At that time, we need to consider as intermediate repairs. Okay, they remove the foreign body like the glass particles and all, and heavily cleaning they done, and they done the single layer also. It should be considered as intermediate or layered closure or two layers. Skin and subcutaneous they will close with different sutures. That also considered as intermediate. Single wound, extensive cleaning or heavily contaminated or removal of any foreign body should be intermediate. Clear? 3 points we need to remember here. Layered closure, two layer closure, or single layer closure with heavily contaminated or extensive cleaning or removal of any particulate matter. Next, complex repair. Complex repair includes the repair of wounds that in addition to the requirements for intermediate repair requires at least one of the following X. Okay. So up to intermediate, whatever you are following, you can follow. Then at least one of the following along with intermediate repair. Exposure of bone, cartilage or tendon. This is the depth. And debridement of wound edges. They must perform the debridement of wound edges, guys. Then only we can consider as complex repair. If they're not done the debridement of wound edges, it should not be complex repair. Clear? Simple, intermediate, complex. Okay, no problem. Next, read the descriptions of some codes I will give. Read these 5 codes descriptions, guys. Once you read it, tell me what you find here. So please read, because I am trying to help you how you need to find the answers and all, rather than explaining everything. I want you people can able to find any question answer like that. You need to learn. So if you go to this,
Simple
yeah, you
repair of
can, no
superficial
problem. You
wounds.
can read yourself. You can read yourself, guys, all the 5 codes descriptions. So 12001, 12011 should be simple repair. 12031, 4151 should be intermediate repair. Okay. So here they given some anatomical locations, right, in all the codes.
Yes.
Okay.
Some locations they given, no. So first thing, guys, see, simple repair of superficial wound, scalp, neck, axilla, external genitalia, trunk, extremities, including hands and feet, they given. In 12011, they given other than the above locations. First, read this point. Sum of lengths of repair each group of anatomic sites. Okay, sum of the lengths of each group of anatomic sites. Okay. Now come to the concept. They given one laceration, single laceration. How to code a location, single laceration location. Whenever they perform the one laceration in the document, what is the diagnosis you will get mostly? For the laceration, what diagnosis you will get when they perform the laceration repair?
Simple.
Neck.
Diagnosis I am asking.
Laceration, wound.
This is what you will get. Laceration only, right? This is also
Yes.
laceration you will get, guys. See, all are working ICD, but you are unable to find anything. Laceration, you will get diagnosis like scalp, face, whatever. Diagnosis check with foreign body, without foreign body, we have codes, okay, for diagnosis. Laceration with foreign body or without foreign body. If they not mention the foreign body, default without foreign body. Whenever they mention the foreign body, you need to go with foreign body. Whenever we are coding the laceration with foreign body ICD code, default it should be intermediate. If you are coding laceration repair with foreign laceration with foreign body ICD code means repair should be intermediate. Okay, what? Single layer closure also, if they remove foreign body, intermediate default. Then without foreign body, whenever they performed, we need to check the type of repair first. Type of repair. We have total 3 types: simple, intermediate, complex. You need to find which type of repair they performed. Then location, where they are performing, which area they perform. Then length. If they not mention the length, default should be minimal length. If they mention the length, based on the length, we have the code. If they not mentioned any length, less than 2.5 centimeters should be default. Okay,
12001 that will code.
not only 12001, listen carefully.
If
Okay.
they did not mention any centimeters, we
So
have to
wait
code
1 minute.
12001.
Wait. Why you will get always 12001? Just listen at least what I'm saying. So default should be minimal less than 2.5 centimeter length we need to take. Okay. So we have total 3 types right here. Simple, intermediate, complex. Based on the type, you will get the code. Then location. Based on the location, we have the code. Suppose they done intermediate repair. How you will get 12001 default? Tell me.
For simple, I'm saying.
Simple also, how you will get default 12001? We have one more code, 12011. In this two, you will get not only 12001. Okay. So here check. In the simple repair, we have two anatomical locations, 12001, 12011. In intermediate repair, we have three anatomical locations, 12031, 5141. Okay. Here they given the some locations. Okay. In these locations, where they performed exactly, we need to find the location in these groups. Okay. If you go to the main code, we have the some locations. Suppose see in 12001, what are they given? Scalp, neck, axilla, external genitalia, trunk, including hand and feet. Suppose tell me 2 centimeters scalp simple repair they performed. What code you will get?
12001.
5 centimeters neck simple repair.
12002.
12001.
12002 only.
Oh, okay, only 12002, 2.6 to 7.5. Okay, these all are based on the length codes, not add-on codes. Okay, based on the length. If they're done 10 centimeter,
12004.
12004. Okay, how much length they performed, based on the length, you need to go with the code and location check. Suppose face 2 centimeter.
12011.
12011. Clear? Huh? So how much length we need to go with that? Now, multiple lacerations that are in the doctor procedures, multiple procedures they perform. Neck. Now, okay. Check type of repair of both wounds. All wounds. Okay. If different type code, first complex, intermediate, simple repair. In this sequence, guys, we need to code simple repair. In this sequence, we need to code. If they documented all three types of lacerations, complex code first, then intermediate, then simple. Suppose they documented only intermediate and simple, code intermediate, then simple. Only complex and intermediate, complex first, then intermediate. Okay. In this sequence, we need to code now. Different types. Okay. Is found. Multiple locations, same type of repair. Same type of repair of multiple wounds. Now, check the anatomical location of the wounds. Okay. Check the anatomical location of wounds. Okay, you need to just check that anatomical locations where they performed, which area. Same anatomical location. Sum the surface area. Which means we need to add the area. Different anatomical site. says wood type same but anatomical location different. Code separately. Clear? Check this concept, guys. If you have any doubt, ask me. I will explain. So whenever they done multiple laceration, check the type of repair. All wounds same type. Check anatomical location. Same anatomical location means sum the length. If different anatomical location means code each one. Okay, what are the lacerations fall under same anatomical locations? Sum the length. Then different types, code complex, intermediate, and simple. In this sequence, we need to code. Clear? Huh?
In one repair also they perform different anatomical sets, then we should code both.
We need to code separately.
In one repair also.
Yes. Same type of repair, different anatomical locations. Okay. Same type of repair of multiple wound. Take anatomical location. Same anatomical location, some different anatomical location, code separately.
Yes.
Clear? Huh?
Yeah, okay.
Suppose now we can go with the example. See, simple repair, scalp 2 centimeter, neck 2 centimeter they performed. Total how much?
2.
4
Scalp
centimeters.
2,
4
neck 2.
centimeters.
Call
4
2, neck
centimeter.
2. Then 12002 it will.
4 centimeter, right? Total. So we need to sum the length. Same anatomical side. So scalp 2 centimeter, neck
Neck.
2 centimeter. We should not code separately. Okay, what? Neck 2 centimeter. Both close with the simple repair. We sum the length for 4 centimeter. We need to code 12002.
2.
Suppose scalp 2 centimeter, face 2 centimeter.
Separately we should code. 1
Uh,
2 0
We
0
should
1 1
code
2
we
12001,
code 1201,
12011.
12011. Both we
11.
need to code. Guys who already know, just to listen. At least who don't know, they will get idea. Okay, scalp 2 centimeter, face 2 centimeter. 12001, 12011 we need to code. And what modifier we need to append here? Na? 51. Okay, same type of repair on the different anatomical location.
Different location.
51. Now, suppose they done one intermediate and one simple, we need to append 59 modifier for the simple repair. Or one complex, one intermediate, we need to append 59 for the intermediate repair. Clear?
Yes, sir.
Sir, you can write and
So now go with the options, practice questions. Tell me the answer for 24.
Option D, 12004.
option C.
Total 7 centimeter, na?
Option C, sir.
Option C.
Option C.
Only 2.6 to
Option C.
7.5. 12002.
2.
4, 3. Option D should be 12004 should be more than 7.5. 12013 and 12014 should be different anatomical locations. We can easily eliminate. Kada. Next question.
Option A.
Option A is
Option A,
A.
12002.
A.
12002.
option A.
Option A.
Option A, sir. A.
Option A.
12053. Forehead, cheek.
It will come under
Option A, intermediate, right?
face.
Same anatomical location they are saying. Still any confusion while we are coding the multiple lacerations? Are you getting idea how to sum the lengths and all?
Yes, sir.
పేమెంట్ పేమెంట్
27 question.
Option B.
What is the option,
Yes,
right?
option B. Option B.
Option B.
Option B.
B, yeah.
Yes, sir.
Thank you. Sixteenth question. Here leave it about modifier, just find the codes. Here modifiers they given wrong.
Option C.
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 Option C.
Option C. फर्स्ट टाइम ही बोलने का हम
Everybody got lacerations?
one is intermediate and one is simple, sir.
Yes.
For
yes.
intermediate,
Everybody get idea about lacerations now?
Yes, sir.
Yes, sir.
Guys, in exam, one case study will get from the lacerations. Only one location they will give. They don't give this much complicated multiple locations also. Simply they will give one location laceration. Okay? First, while you are coding the lacerations from the exam point of view, don't expect the same location what we are giving in the paper. They will give any location of the laceration. That's why I am explaining this much concept for the laceration repair. Suppose I given the paper in the hand, you don't get only hand, you will get chin, face, okay, arm. Location they will frequently change. Just you need to find where they are performing the laceration. If you go to the procedure note, they will give location. Which location they are performing the laceration, that only PDX. Okay. Then check in the local procedure note type of repair and suture material. Then you will get idea. They done the simple or intermediate. Any layered closure, 2 layer, they mentioned intermediate or heavily contaminated or extensive cleaning also intermediate. If they not mentioned single layer, simple. We'll get only simple and intermediate guys. In emergency department, they don't perform maximum complex repairs. Then check the length 2.5 or 3 or 2.8 how much they perform. If they not mention the length, default minimal length. Okay. Any doubt?
Yes, Shiva. In examination point of view, they mentioned directly type of repair or also any
Sometimes
type of
they don't
work.
mention default type of repair. Okay, they will give how many layers they performed the repair. Single layer, multi-layered. Okay.
So type of gauge also sometimes mentioned, right? They are
Sometimes they
using.
will do directly simple repair. Sometimes what they will do, no, they will put heading simple repair. Then in the amount of cleaning, they will give extensive cleaning they performed. Then simple repair also go with intermediate, right?
Yeah.
That's why based on the header itself, don't confirm. Check the entire document. If they're done single layer also, look, they done any foreign body removal or heavily contaminated or extensive cleaning. Okay.
Sir, for one repair and different anatomical location, we have to open 51 modifier.
Same type of repair, different location, 15. If different type of repairs, 59.
Yeah, okay.
One intermediate, one simple, they perform simple 59. Same laceration type, simple repair, two different anatomical locations, then 51. Same type of repair on different anatomical sites, 51. Clear?
Hello?
Yes,
Yeah,
yes.
Shiva, can you please go back the previous question?
Cheppandi.
Previous question.
Mhm.
Here they mentioned intermediate and simple closure, right? Both.
Yes, yes.
Then why we
Yes, yes.
have to code 51 modifier?
That already I said, right? Modifier they given wrong. Leave it about the modifier. Just go with the code.
Okay.
Before answering the question itself, I said that, but you didn't listen.
Yeah. Okay, thanks.
Modifiers they given wrong. That I already said. Next concept, burn dressing. Burn dressing also you can lead directly in the burn dressing guys will get in exam. Like burn dressing in index also will get burn dressing directly under burns dressing. If you check, you will get the codes. While we are coding the burns, you need to check diagnosis point of view, degree of burn, third degree, second degree, first degree. Whenever they done multiple degree of burns, code the sequence deepest first, like third degree, second degree, first degree. In this sequence, we need to code ICDs. Okay, third degree burn, second degree burn, first degree burn. In this sequence, we need to code. Whenever they performed, only single burn, easy. Whenever they done multiple burns, only look for the ICD sequencing. Then procedure. Whenever they done the first degree burn, 16300 initial treatment. For second degree and all dressing they will do. Based on the percentage, how much percentage of the burn dressing they done? We have the code 16020 less than 5% body surface area. 25 should be 5 to 10% of the body surface area. 30 should be greater than 10%
10%.
of the body surface area. How much body surface area they performed, based on that we have the code. Suppose if they not mentioned any body surface area, we need to go with minimal length less than 5%. Okay. If they mentioned dressing and body surface area, go with the percentage. If they not mention the percentage, go with the minimal percentage, default 16020. Clear? Clear?
So,
Okay. Now we can practice the questions. First one.
Option A. 1602. 16020.
option A.
Option
25 per second.
Option
A.
A.
160.
20.
20.
Second one.
25.
16025.
25.
2.
30.
2.
Option 160.
25.
25. B.
Then third one.
30. Third option.
160.
30. 160.
Sir, previous question.
C.
16025, right? 8 centimeter.
Yes, sir.
Yes, right.
Hello, sir. Two
Yes,
question
yes.
not mention any means second degree or first degree. Sir.
Done. Partial thickness. Partial thickness means what is the
Second degree.
Okay.
Second degree one.
partial thickness means second degree? Okay. Full thickness means
Yes.
third degree. And they mentioned dressing change also, right?
Three zero.
16030.
160.
16030. Clear? Any doubts?
No, sir.
No. Okay, let's tomorrow we can practice the remaining concepts. Tomorrow onwards, 8 to 10, we have the session. Okay. Because yesterday I didn't took no. I need to extend half an hour, and I will cover. Okay. Tomorrow and Saturday also we have the class this time. Okay.
Okay, sir.
Saturday also please join. Okay. Tomorrow and Saturday we
Okay.
have Saturday I didn't took the session, right? That's I will cover Saturday. Tomorrow and day after tomorrow, 8 to 10, 8 to 10. Please adjust your plans. Okay. Next 2 days. Okay.